where flowers never die, and friends don't pass you by. That's my home, where folks say, how to do, and they really mean it too, and mama's love is true. That's my home.
You know, it's just a positive place to be. It's the kind of place you want to work in, where you feel supported and you have a team of folks that are all here trying to accomplish the same mission, and you know, believe in what they do. And it's a rewarding place because you've got you know, the interaction with clients all day long, and folks that really you can see how our involvement in their lives makes a positive difference.
With the population of elders growing several times the rate of the general population, Adult Day Healthcare offers a way for more people to remain living in the community as they grow older. Participants usually come to the Day Health Center in the morning and return home in the afternoon. The number of days a client attends the program depends on their care needs. For many people, coming to an Adult Day Health program can mean the difference between living in their own home or needing to move into a nursing home or other care setting. Adult Day Health Centers are focused on preserving every participant's dignity, quality of life, and independence.
Ache here and pain there, and you know, I thought that this isn't going to be worth it, living to get old, if you're constantly in pain. But I changed my mind. As I get older, I change my mind.
Most people who attend an Adult Day Health program will tell you that the most important reason they attend is the friendships they have developed or the group activities they enjoy. But an Adult Day Health Center is more than just a senior center. Every person here is working to cope with a chronic illness, a terminal illness, or serious disability of some sort. Many of the clients at Adult Day Health Centers have Alzheimer's disease or some similar form of dementia.
At issue is surveillance, that is, patients who are frail, who perhaps are cognitively impaired, and on their own, or even with help of loved ones, wouldn't necessarily be able to complain of or pay attention to symptoms they might have. When skilled professionals are around, nurses and others who know a patient, who are seeing them in the setting of day health, we can get ahead of a lot of the symptoms that our older patients might have before they become horrible problems that might lead to a hospitalization, for instance. So I think it's a type of preventive medicine, not to mention daily medical care, that people receive to prevent the really awful occurrences that can befall people of that level of frailty.
Skilled Adult Day Health Center staff make sure that clients get all the medical attention and other services that they need to maintain their health, their physical functioning, their safety, their social connections, and even their outlook on life.
Occupational therapy is huge. Our main goal is to improve functional independence for our clients, and we do that many different ways, through improving strength, flexibility, coordination, endurance, and of course balance. And when we do this, we see people change in many different ways. They may become more independent in getting off the excess van. Someone else may transfer more easily from a toilet back onto a wheelchair. And we do this with the primary goal of making sure that their global functional independence and quality of life improves.
I've been a nurse for 28 years now. Most of that's been in hospital nursing. But the last 9 years I've worked as a nurse at an adult day health program, and it's been very rewarding for me, probably the most rewarding of my career. Nurses at Adult Day Health provide a variety of roles. One would be an assessor. We see clients on a daily or weekly basis, and we are able to notice the minute changes or just gradual trends in vital signs, side effects of medication, behavioral changes, condition changes that you might not see at a doctor's office. We also we're a provider of direct care, and that helps families and caregivers quite a bit. We are able to provide, the medication administration, the tube feedings, colostomy care, foot care, blood sugar, diabetes monitoring. There's quite a variety of direct care that we can give. Thirdly, we're coordinator of care plans, and daily the staff and the nurses meet daily to discuss client issues, and that gives a well-rounded care plan for the clients. We advocate and educate clients and their caregivers on multiple issues, and because the clients are here on a regular basis, we develop a relationship and they trust. We do collaborate with physicians. I call physicians' offices often or fax them with information that we've noticed. Also, we contact caseworkers, caregivers for the adult family homes or family, many times all at once. If there's an important issue, I make sure everybody is aware and that we can work together as a team. And I can think of instances over the years where I believe I've prevented emergency room visits or hospital stays.
Honestly, I don't want to be too dramatic, but it's made a huge improvement in my life. I don't know that I would be able to take care of her, and even if I could, my health had been going downhill. Without this, without going into specifics, my life would be completely altered.
And I'm back home now with my husband, and if not for this program, I'd still be in a damn nursing home. And that just about killed me.
But I was really weak, I could hardly sit up. But then after I entered the other house last May, I did the exercising, and Colleen worked with me one-on-one, and I began to sit up and then stand up, and in 3 months I was walking. And it has made such a difference, such a change in my life.
Basically a train wreck. I mean, I was on oxygen, I was using a walker.
And if I didn't have that service, I don't know what I would do.
It has been helping her a lot to do the exercise she needs at home and keeping her memory alive. Otherwise, I don't think that I would be able to keep her with me at my house for all these years.
If I didn't come to Aldergrove, it would be so much different, and it would be of a shame.
I was a mother of 4, 3 daughters and a son, which is the baby.
I'm a veteran of World War II. I fought the war in the Philippines and Okinawa and Japan.
I used to be a nurse at Swedish Hospital.
I had a job in there helping to assemble propellers during the Second World War, B-17 bombers.
I grew up in Brooklyn, and then gradually I worked as a butcher, cutting meat, and then cutting down the hindquarters.
I used to teach a 4th grade in Mississippi, and had a very good time with the children.
I think your best teaching is experience. You can't get it out of a book. When you learn with your eyes and your ears, you learn a lot.